and then hopefully people will join. All right, everyone. Thank you for joining me for my Kinstretch class. We're going to focus on lower extremity. So we're going to start with a warm-up of cars. So we're going to do some spine cars, hip, knee, and ankle. And then we're going to move through a few base positions. So go ahead and grab your yoga block if you have that. And so what you're going to do is just grab it at the chest. So we want to work the spine through a linear range of motion first, and then we'll take it through a rotational path after that. So go ahead, grab your yoga block and try to isolate the upper back. So right now, we don't want the hips to come into it or the lower back. So what you're going to do is bring your head up towards the ceiling, deep breath in. I want you to slowly tuck chin to chest. And then what you're going to do is slowly start to peel the back of the neck open. So you're going to squeeze the glutes. Once you get to that end position without the lower back becoming involved, I want you to extend one vertebrae at a time from the bottom up. So let's try to do that 2 more times here. So it's going to be a pretty small movement. So slowly going to curl forward. Then one vertebrae at a time, we're going to bring it up nice and tall. So again, we're going to tuck chin to chest. Slowly start to peel spine open. Then again, extend from the bottom all the way up to the top. Try to focus and see if you notice some spine segments not moving independently. So now what we're going to do is take it through a rotational path. I see we have a few people joining, so thanks for joining. So now I want you to slowly curl forward here. So same thing. Now, once you get to that end position, I want you to rotate to one hip. Again, squeezing glutes so the hips aren't coming along for the ride. Baby side bend. Bring it all the way up and around. Once we get up and tall, we're going to rotate towards the other hip. We're going to forward fold. And then scoop it forward. So we're going to do the same thing the other way. Trying to isolate still upper back area. So slowly start to forward fold. Rotate towards the other hip. Once you max that out, little side bend. Bring it up tall. Squeeze the glutes. Rotate towards the other hip. And bring it forward. Slowly bring it up. We're going to do the same thing once more each direction. So also with our warm-up, this is a great time to see if you feel any discomfort, pinching, or pain. And if you do, make sure you don't move through those ranges of motion. Just keep that as a mental note. So bring it up nice and tall, all the way to the other hip. Scoop it forward and bring it up. All right, so super important that we can move upper back independent of lumbar spine and hips. So now I want to move down to the hips. So grab your sticks if you have those. If you don't, maybe grab a wall. So you can even use 2 broomsticks here. So I want you to drive the sticks into the floor, scoop the leg up. So we're going to hip external rotation as we scoop up, trying to hold that position, maxing it out as best we can. You're going to bring knee up towards the chest. You're going to open up the gate. So if you feel pinching here, I want you to bring the hip down just a little bit. So we want to move through a range of motion that's not pinchy or hurty. So same thing here. So now we're going to squeeze back, open up the gate here, carving out the hip. So knee is up taller. We're going to scoop the foot in, slowly lower it down. So let's do that again. The reason why I use my sticks is so I can isolate my hip joint better. So I'm pushing into my sticks. We're moving at about 30% irradiation out of 100. So that means we're moving through slight tension. Okay, let's try other side. So you want to scoop the foot in, bring it up tall. Again, make sure the hips don't come along for the ride. So tall knee, open it up, drop the knee, heel comes back. And you want to make sure you don't go into a really big arched back, all right? So squeeze the glute, open up the hip here. Notice how I'm not compensating anywhere else. Scoop the foot in, slowly bring it down. Last one. So you might notice one hip has a little bit more range of motion than the other. That's all right, it's pretty normal. So this is part of the morning cars routine, and it's a great assessment tool. That's why we always use rotational movement before we go into linear, except spine. So it's a good assessment tool, given pinching or pain. So now we're gonna go down to hands and knees. We're gonna work hip cars in a quadruped position. So we're just gonna practice some stuff that's coming up in class. So same thing applies here. You wanna push up into the shoulders. You wanna make sure you have a nice tight core. You're gonna drive the knee up towards the elbow. You're gonna sweep the knee out. And you're gonna drop the knee, heel comes up. Notice how I'm not arching the back, all right? I'm gonna move this plant because we can't really see it. So, same thing, squeeze the glute, stay right in the hip, drop the heel, knee comes out. So you're really trying to get all that information from your hip capsule, joint capsule, seeing what's going on in there today. So, extend, bring out the knee, heel comes down, scoop it forward. You're gonna do the same thing on the other side. So I'll just turn around here. So same thing, knee comes to elbow, open it up, drop the knee, heel comes up tall. So we're trying to work through the outer edges of the joint. And then as we get into our actual work, we're gonna see if we can get a little bit more range of motion. So this is just an assessment and a warm up. So we're gonna stay down here on the floor now, moving down to the knee. So you're gonna go ahead and grab whatever leg you're starting on, use the same arm, you're gonna scoop it under, all right? So you're gonna hook it, and then you're gonna grab your bicep with that same arm, okay? So then this arm's gonna just clamp the knee down, and so we're working on knee rotation, so knee cars. So I want you to focus on rotating that foot out as best you can. You wanna hold that position, extend it up, windshield wiper it in at the top, squeeze it down. So now hold that position, extend, rotate at the top, squeeze it down. So here we're working on some tibial rotation. So you might be able to see your shin, that muscle activated as you internally and externally rotate the foot. So you're gonna sweep it up, rotate the top. So it's a really big component to make sure we can have rotation at this area of the knee, independent of the hip and ankle. So, okay, bring it down. So now we're just gonna, since we're already here, hold that same position. And what I want you to do is just focus on the ankle. So same thing, I want you to try and point the toes as far as you can down, scoop the foot in as best you can without bending your toe knuckles, all right? So scoop it in, bring it up tall, bring it out. So we're working the outermost edges of the joint capsule here, talking to our nervous system, seeing what's going on. So go ahead, or switch. So same thing, try and carve out the ankle joint. Also, really try to activate the muscles all the way around. So trying to pull up the toes as best you can towards the ceiling, scoop the foot in, and bring it down. So let's go ahead, switch sides, same thing. You're going to hook your arm under, grab your bicep, anchor down the knee. So from here, you're gonna rotate the foot out. You're gonna extend the top, rotate it in, squeeze, squeeze, squeeze. Good, so hold that position, try to get as much internal rotation and then as much external rotation of the foot as you can. So we're gonna pivot at the top. Good, extend, rotate, windshield wiper it down. Good, bring it up, rotate, bring it down. Now, once we're down here, we're just gonna go straight down to the ankle. So same thing, point the toes, scoop the foot in. So for me, my left side's a little bit harder to control. Neurologically, it's just not lefty at all in anything. So today you might learn a lot about yourself, what you can work on, and you'll notice how one side of your body might just cooperate a little better. So go ahead and switch directions. So again, trying to carve out as much joint capsule as you have right now. Good, point the toes down, scoop it out, bring it up, try to light those muscles up, and relax. So before we get started with the meat and potatoes of today, if you have any pinching or pain, that's important information, so don't move through it. You can always come to me after class or DM me, and I'd love to work on that with you. So we're gonna go ahead and get started with our first base position, which is 90-90. So a lot of people can't just start up here. So if you're one of those people who need to, pinching in the hips here, that's not a great sign. We don't want that. So see if you can put yourself out here at a kickstand position. Front leg is at 90, back leg is at 90. So everything, hip, knee, ankle, everything is 90. All right, so if this is still really uncomfortable, you can grab a block and sit on top of it. And that should help a little bit decrease the amount of angle that you're sitting in. So I feel pretty good here. I'm going to just hang out here. And so what you want to do in this position is find your line of tension. So for me, I don't feel much of a stretch anywhere here. So what I'm going to do is I'm going to rotate my pelvis forward, and I'm going to focus on pelvic tilting. So I'm going to scan, I'm going to bow and scan the stretch. And if I can orient my pelvis in a good way, I already feel a little bit more line of stretch on the bottom side of the front leg. Then I'm just going to kind of pull my chest forward and over my knee, and I feel a great stretch here. So this is where I'm going to hang out. So find your line of stretch. It's going to be different for everyone, and then you need to hang out there, breathe. So we're going to start with external rotation, pails and rails, which is the front leg. So the front leg is going to be trying to go into external rotation, but it's not moving anywhere. So while we're hanging out here in this position, we're not just doing nothing. We're staying in the stretch position for, again, 1 to 2 minutes. If your foot goes numb, that's not really a bad thing. Just come out of the stretch or make your stretch a little less intense. So that just means we have to increase your stretch tolerance. So pails and rails. Pails is a progressive angular isometric. So that's the tissue that's on stretch. So the tissue that's on stretch is all this tissue on the back side. So that's what we're going to be working. Rails is going to be the regressive angular isometric. So it's going to be the shorter side. So that's all the tissue on the inside right now in this position. So what this does is we use isometrics to open up more range. All right. So very important concept. We're going to still hang out in our stretch and breathe. When I say to start ramping up, you want to pack the air down to the abs. So we want to irradiate through the whole body. So we're going to pretend like there's a scale underneath our front leg, and you're going to get really heavy into the scale. I'm going to say 20%. You're going to push down 20% with your leg. Then we're going to go up until we reach our greatest, safest effort. That's our pails. Then when I say rails, you want to try and lift. You're trying to do this motion, but we're not going to move anywhere. So you're trying to pull yourself up off the floor, but you can't move, and then we'll relax. So go ahead, take a deep breath in. Pack the air down to the abs. So hands are on the floor. If you need yoga blocks here, you can also use these if you're not very comfortable with your hands all the way on the floor. So slowly start to drive your leg down to the floor, get heavy into the scale. I'm going to go 20% out of 100. So you're going to try and match that intensity with your whole body. Now you're going to try to drive down at 40%. Trying to drive down 60, so we're getting heavier. Let's go 80%. Greatest, safest effort. We're going to push down as best we can. 5, 4, 3, 2, 1. Relax that position. Now rails, try to pull your leg up off the floor. Pull for 5, 4, 3, 2, 1. And relax. So that was Round one, we have 2 rounds here. So it's really important that you don't come out of that position. Try to breathe and tell your nervous system that you're safe here now. So a lot of times we get injured because we're in a position our nervous system our body isn't used to producing force. So if you're in a new position and we're using isometrics here, this is a really safe way to build strength in a new range of motion that you've just acquired. So like right now, we're just gonna stay here. Really try your best not to come out of the stretch unless your foot is numb. Then I would recommend kind of regressing your ankle. All right, so I like to go through 2 rounds and then we'll work from there. So let's go again, deep breath in, pack the air down to the abs. Slowly start to drive the leg all the way down to the floor, 20%, so get heavy into the scale. Let's go 40%. Ramp it up to 60, make sure your whole body is ramping up. Let's go 80, make sure you still have a good stretch. Greatest, safest effort. 4, 3, 2, 1. Rails, try to get light off the floor, but you're not moving anywhere. 3, 2, 1. Relax. So take a few deep breaths there. Just kind of relax everything. Good. So now what I want us to do, go ahead and come out of that aggressive angle. All right, so now we're going to come down to our side and we're going to go through some hinges. So you could even start a little bit further out. So I want you to anchor down this knee, and from here we're still working external rotation. I want you to try and scoop the foot off the ground and see how much room you have from the ground. So try to hold and slowly bring it down. So now we're just working through some range that we may have opened up. We're going to scoop it up, hold for just a little bit, slowly bring it down. Good. So from here, let's try to windshield wiper the hand out and push yourself up into a more upright angle. So this is only if you can clear a good amount of space on the ground. We're going to just kind of work through different angles. So just hold, control it on the way down. Make sure you're not bending your heel all the way in. So try to keep it still at a 90-degree angle. So try to walk yourself up a little bit more. So we're going to increase the intensity here. You might not get much off the floor. So see how it really decreases my ability here. So you're going to sweep it up, hold. Bring it down. 3, we're gonna go 2 more. 4. Good, last one here. Scoop it up, hold. 2, 1. Good, bring it down and relax. So now what I want us to do is we're kind of just gonna windshield wiper it out here. So, whew, that's a long time on that side. So just try and give your leg a little bit of movement here, a little dynamic movement to shake it out. Then what I want to do is we're going to work the same leg in internal rotation, and then we'll move over to the other side. So internal rotation is a lot more difficult. You might feel a lot more tightness here just because that hip capsule is already stretched in this position, and you might already be pretty limited. So what we want to do, whatever leg you just worked on, make sure it's the trail leg now. So what you want to do is try to rotate towards that leg. Again, if you need, sit on a block if this is too intense for you, or try to sit yourself kind of back. All right, so the goal here is to be sitting and relaxing right now. And internal rotation, you might feel it's like a little twisty, like a rope is twisting here. That's okay, but if it's pinchy and it hurts, that's not okay. So if that's the case, I want you to try to, again, get yourself in a comfortable position. So you might need to sit on a block or whatever you need to do, all right? If that's still not okay, come onto your back. What I want you to do is, so bring your heel out tap the heel on the floor and drop it here. So you can work from here. And if you do, just cross the leg over and hold yourself here. So it'll be the same concept. So there's always a way. So now what I want you to do is rotate, try to sit into your hip and find your stretch. So for me, I feel a good stretch here. So I'm gonna hang out, I wanna breathe. Again, the typical prescribed amount of time is 2 minutes to just relax into your stretch. Again, if you have some numbness or tingling, kind of come out of there. So what we're gonna do now, I'm gonna talk you through internal rotation, tails and rails. So same concept here. You're gonna pretend like there is a scale underneath this leg and you're trying to get heavy through it. So from knee all the way down to ankle, you're getting heavy into the scale, 20% at a time. And again, moving with your own caution. So this is a little bit more intense. So making sure your whole body is ramping up as well. It's not just the leg, all right? Core, everything. So we irradiate first from in here. So we're gonna take a nice deep breath in, back it down to the abs. Start to slowly scoop that leg down into the floor. So you might already feel this lighting up in here. So 20% down to the floor. Let's go 40%. And again, move through your best efforts. 60, 80, greatest, safest effort. 3, 2, 1. So rails, this one's tricky. You're trying to get light off the floor and you're trying to pull your hip closer to the floor. All right, so try to get light off the scale. You're gonna feel this muscle right here light up, all right? So light and pull your hip closer. 3, 2, 1. Relax in that position, okay? So you might feel cramp city in here. So I feel cramps right here. So that's okay, that's normal. Stay there. I'm gonna do my next round in the supine position to show you all what this looks like. So same thing, I'm gonna find my internal rotation. I'm dropping it down. We're all hanging out, whatever position that we're in. So in between tails and rails rounds, we want to make sure we are relaxing and we're staying in our newly acquired range of motion. So we're working through some new stuff here today. Don't be scared if you're sore after this, because you probably will be. All right, so same thing here. So for this position, I'm gonna do the same thing. Deep breath in, pack the air down. From here, I'm gonna get heavy with this leg on top of the other leg. So this right leg is a statue. All right, we're gonna go down 20%. We're gonna go up to 40. We're gonna go up to 60. So this leg is driving down into my stretched leg. And I can't remember what I said, if we said 40 or 60. So let's go ramp it up to 60. Let's go 80. Greatest, safest effort. 3, 2, 1. Now for the rails, I'm trying to get light off of this top leg. So I'm pulling my knee closer to the floor. 3, 2, 1. Relax. So now this top leg is going to help me stay in my new position. So also important, make sure you keep your hips on the floor if you do it this way. Because if I'm all the way over here, that's not my hip. That's not going into my lower back, all right? So everything we do here today, super important to make sure that you're staying true to that hip, that capsule, because if something else comes along for the ride, that's not your true joint capsule. So we're not benefiting from that, all right? So I want you to get the most bang for your buck out of this. So now, from this position, we're gonna work and do some lift-offs. So, try to rotate yourself, orient yourself towards the front of the leg. From here, try to rotate and lift your heel up off the floor without your hip dumping forward, okay? So try to lift and then hold and then bring it back down. So if you need come forward, you should get way more range here. So kind of play around for a minute, find where you're able to kind of challenge yourself still, and then also get some lift offs. So I'm gonna be right here. Pack the air down, lift, hold, 3, 2, 1. Good, bring it down, reset, lift, 3, 2, 1. Bring it down, come right back up, 3, 2, 1. Bring it down, 2 more. Bring it up, 3, 2, 1. Down, last one, lift, 3, 2, 1. And go ahead and let that leg relax. So we call those lift offs. We're working through ranges of our active range of motion here. So to make it a little bit more intense, we're gonna find ourselves in a position we call passive range holds. So try to find yourself in a position where you can't lift your leg up. So for me, I can't lift my leg off the floor here, so that's perfect. I'm gonna hang out here. And what I'm gonna do is make sure I start to try and lift my leg up so this whole leg is a statue. All right, I'm all engaged here. Now, hold, we're gonna roll forward, hold, and then bring it back down. So now, we're using isometrics to put ourselves in a position we're not strong enough to lift up yet. But we have strength here to hold ourselves in this position. So what I want you to do is find that position, roll forward, hold, 2, 1. You might feel some cramps in here. This is like cramp city with hip internal rotation. So hold and roll forward, 3, 2, 1. Woo. 2 more. Squeeze, lift, 3, 2, 1. Good, last one. Reset. 3, 2, 1. Good, bring it down. So a lot of intensity on this hip right here. We only have one more thing we're gonna do here. Oh, okay. So from here, what I want you to do is take your block if you have it. All right. So what you're gonna do is you're gonna lift up. So we call these hinges. You're gonna lift up here, squeeze, bring it back. We're gonna go 3 reps here. 2, 3. You're gonna slowly bring it down. So I'll give you another angle. So I have my block here just so I can keep myself honest, okay? So we don't want our hip to come into flexion. So lift up, extend, 2, 3. Good, bring it down. So now what we're gonna do is we're gonna switch to the whole thing on the other leg, all right? So, hold on. All right. So, I only have 8 minutes left. That's good. That's great. All right, so we are gonna go on to the other side. So pails and rails here. So scan, find your stretch here. So what I want you to do is, again, same thing we did on the other side. So try to roll your pelvis forward. And also pull your chest over the knee. So from here, we're just gonna hang out, breathe 1 to 2 minutes. Again, if you are getting numb in that leg, try to find yourself a little bit regressed off of that. So you might, again, notice that one side is a little bit easier than the other side, depending on which leg you favor more in like just your natural everyday life. So again, try to rotate your pelvis, and we're bowing and scanning. We're breathing, calming down the nervous system before you ramp it up. Also making sure that our back leg is at 90, because a lot of times I forget that too. And if you're hypermobile like me, sometimes I place a block underneath my front leg just to get more stretch. So there's always possibilities here. All right, so just a quick refresher. Remember, we're gonna pack the air down to the abs. We're gonna drive the foot down to the floor. All right, and we're gonna go up 20% at a time. So what I want you to do is take a deep breath in, pack it down, drive the leg down to the floor, 20%. Good, let's go 40%. 60. Let's go down to 80. Keep everything engaged. Greatest, safest effort. 5, 4, 3, 2, 1. Rails, try to squeeze up towards the ceiling. 5, 4, 3, 2, 1. Whew, relax. Good, don't come out of that stretch immediately. So just hang out there. And you might notice you get a little bit more range of motion. So using isometrics, again, producing force in that position, then we let go. Our body feels a little safer to move into more. And typically you'll only gain about 10 to 15 plus or minus each time we do this. So it's not gonna open up a lot, but over time you will acquire more. So again, reset, play around with the pelvis, feel your line of tension. It's gonna be different than the other side, most likely. So same thing, deep breath in, pack the air down, drive the leg down to the floor, 20%. Let's go 40. Drive down to 60. Keep ramping it up to 80. Greatest, safest effort. 3, 2, 1. Rail squeeze, get light off the floor. 4, 3, 2, 1. Relax. Yeah, my left side definitely a lot tighter than the right. So from here, I want you just to come up, try to windshield wiper it, back and forth. Try your best to not use your hands. So try to peel that leg open, let the other one follow as it comes down. So we're trying to open up that back leg and then let the other one follow. So you're actively going to pull one leg open, then the other leg will follow again. Let's go one more here so we can end up right back to where we started. So we're going to go into our lift off. Same thing here. So from here, find yourself in a position where you can easily lift off. You're going to anchor the knee down. You're going to scoop and you're going to hold. And then slowly lower it down. Try to go for 5 reps. 4. Let's go one more. Good, so you can windshield wiper it and then bring it up, or find yourself now in a position where you're it's a little bit harder to work, okay? So for me, it's right here. So 5 reps here, bring it down. Still packing the air down into the abs so we have a nice strong base. 3, 2 more. So you really want to make this a challenge. You want to fight for it. Last one. 3, 2, 1. Good. Relax it down. So we're going to go ahead and transition right to our internal rotation work. So same thing. Try to the leg we just worked on the other in external rotation. We're now going to work internal rotation. So try to orient yourself in a position where you feel a pretty good stretch in the hip. In here, we're working really deep hip capsule. So the deepest layer of of your tissue is your hip capsule. So working all the way in there a lot with the ER and IR stuff. So find your stretch, grab your blocks if you need them. So I always start with this work first. It's really important to make sure you can have a healthy hip, which we need to be able to rotate, flex, and extend. So it's all important stuff. And I think the most important thing to you is going to be what you lack the most. So this is a great way to assess what you need and what you can work on. It doesn't need to take a whole hour. It can take just a few minutes a day. So definitely the cars are a great tool for that, great teaching tool. So again, making sure your foot's not falling asleep. You're still feeling a good stretch. You're still breathing. Quick review. Tails, we're driving down into the floor from knee to ankle. Rails, we're getting light off the floor. We're trying to pull our hip closer to the floor. So this hip, we're trying to get deeper into the floor. So we're about to be Cramp City. Deep breath in, pack it down. So slowly start to drive, leg down to the floor, 20%. Remember, foot to knee, 40%. Let's go 60%. 80. Greatest, safest effort. 3, 2, 1. Rails, get light off the floor. Pull your hip closer to the floor. 4, 3, 2, 1. Whew. Relax. I got a cramp right here. So if you're cramping, you're not alone. That's the good stuff. So relax, deep breath. Good, so we have one more round here. So deep breath in, pack it down.